You found a lump, now what? So as soon as you feel a lump, most people think the worst. However, most lumps are not cancer. There are lots of healthy explanations for breast lumps, especially just uneven, healthy breast tissue, fluid-filled cyst bubbles, or healthy growths that aren't cancerous at all. Before you jump to conclusions, take a deep breath, call your doctor, and see if you can get in with a practitioner who can look at the tissue with ultrasound. Feeling is fine, but even the most experienced doctor's fingertips can't really diagnose exactly what's going on under the tissue until we really look at it with ultrasound. When you feel a lump, the most common reasons to have a lump is healthy uneven tissue or fibrocystic changes, fluid-filled cyst bubbles, or healthy growths in the breast tissue that aren't cancerous, sort of like the breast tissue equivalent of having a flesh-colored mole or a little skin tag. When a patient comes in with a lump that we can feel, we can have a pretty good idea if it falls into sort of the green light, yellow light, red light category. There are certain characteristics of things that we can detect on physical exam and see with the ultrasound that gives us a pretty good idea of whether we think something is not cancer at all, something totally safe, something that's a little bit questionable and maybe deserves a little bit more investigation, or if something is concerning and we need to take action, we take swift action and we talk to patients about what the outcomes might be and what they might need to be prepared for in a very hopeful and positive way. If you find a lump, number one, don't panic. Number two, make note of how it feels, where it is in your breast, so that you can talk to your doctor or practitioner about it and give them a better idea of what's going on. We don't want you running to the internet and opening up all of those horrible Pandora's boxes and having all of those creepy crawly ideas come out and having you hit with nothing but cancer, cancer, cancer. If you find a lump, we're here for you, and more than likely we're going to give you great news. We're going to be able to take care of it and give you some positive, hopeful things to think about.